Dr. Evan Che, Kinetic Rehab and Spine. Welcome to our channel. Click the link below to subscribe, share, and like our videos. Join today, join the movement, gain access to insiders' education on how you become a better you. Welcome to your destination of health and wellness. All the best. Sempre Avante. Always forward. Hi, Dr. Evan Che here from Kinetic Rehab and Spine. The next mobilization technique is a T8-T9 mobilization technique. Now, I want you to get into this posture right here. Knees bent, chest up. From here, you're gonna raise our arms up. Now, this is internal rotation. You wanna do external rotation, rotate out. And you wanna breathe. Inhale, exhale, and you wanna breathe from the nose to reset the diaphragm. The chin is slightly tucked down. And exhale. Perfect. So keep on breathing, about 6 to 10 breaths. That breathing from the nose itself, inhale, exhale, is going to reset the diaphragm. The diaphragm comes from T6 to T12. That's where actually the ligaments and the soft tissue merge, is from T6 to T12. So we want to open up the diaphragm by doing that, and we want to rotate outwards. For people that have shoulder pain, this actually decreases shoulder pain, because most people, when they rotate outwards, it actually decompresses the shoulder itself. Hopefully you enjoyed this mobilization technique. I'll look forward to seeing you on future ones.